abolishes this response. So the cornerstone therapy of diseases like asthma, which is a manifestation, lung manifestation of allergic disease, is steroids, if not, in a severe cases, steroids plus beta-2 agonists, but it is definitely not only beta-2 agonists such as salbutamol. Okay? Further, this led to a very strange hypothesis, which I personally disagree. It is called hygiene hypothesis. Now, what it said is, because your response increased to the type 1 mechanism called TH2 type 2, leading to TH2 cells increase, a number of TH1 cells decrease in diseases like allergy. So what it suggested, this observation essentially came from some prevalence data which they collected from countries like India and other developing countries, and they found the prevalence of allergic diseases such as asthma and allergic diseases was relatively lesser in India, but much high in European country. Now they found what could be the reason. So yes, in India there are slightly unhygienic environments. There are people living, when you compare it with Europe, there are people, we have so many viral infections, exposure to tuberculosis. So perhaps because we have more of TH1 response and less of TH2 response, TH2 cells, that is why we are protected from diseases like allergy. But frankly telling you, if it is true, prevalence of asthma and allergic rhinitis is now rising relentlessly in India. It's the only country which is showing a peak. So do you think hygiene hypothesis should have any significant impact? But some Japanese are doing some research and they have really shown the role of probiotics, which Dr. Prakash had also mentioned, role of probiotics in allergy, and there is some bacteria which they give, and these are still in animal research, but Lactobacillus reuteri and Lactobacillus rhamnosus were given in a tablet form, and which causes an increase in TH1 response, and there is an concept that this may help in controlling the asthma. So it is basically the imbalance between TH2 and TH1 response which has led to this hygiene hypothesis. Finally, as I mentioned, IL-4, IL-5, IL-13, their main function is to cause different things, but another main function is to attract eosinophils, which are one of the most important cells in allergy. So we have discussed, we all know, whenever we talk about asthma, we talk about allergic rhinitis, we talk about eosinophils. Am I right? It's a spine reflex, eosinophils. If it's allergy, it is eosinophils. Now, why this eosinophils has come in? Now, allergen, if you see the structure of allergen, it is big. It's a macromolecule, while bacteria is a micromolecule. Okay? Bacteria can be finished by neutrophil. Allergens cannot be finished by neutrophils. Do come, but they cannot destroy the allergens. Right? They require some different cells called eosinophils, which, because of the presence of these proteins called cytotoxic proteins, which is eosinophilic cation protein, major basic protein, and so on, have propensity to neutralize or destroy or paralyze or finish the allergen in the body. Okay? So that is why in allergic diseases, eosinophil is more important compared to neutrophil. These are some pictures which I'd like to show you. Is a normal patient and patient exposure to allergen. This is the number of eosinophil rises, and this is what usually happens in allergic diseases. Another function is an antigen presenting, which has been seen lately as one of the functions of eosinophils. Now, eosinophil accounts to how much percentage of cell in body? Pardon? 4 to 6%. So do you think that so much eosinophil, how come so much eosinophils are finally you see in the blood of an asthmatic? The percentage of eosinophil rises above 5% or 6%. how come so many eosinophils rise in the blood of asthmatic? If you do their sputum induction, if you do their blood, there's still a lot more eosinophils. It accounts for 2 to 3% cells in your body. Then how come so much? How come these eosinophils increase in the body? Now, as I told you, this is where it is important. IL-5, particularly the IL-5, is a very potent eosinophil poiesis inflammatory mediator. So Th2 cells in the lungs or in the allergic nose secretes a lot of IL-5, which spills into the blood, goes to the bone, and incites the eosinophilopoiesis. So eosinophil numbers start increasing, and then they go into the blood. Further, because of the same inflammatory mediators, enter the tissue and release all the cytotoxic and bad and oxidants and inflammatory mediators and cause tissue destruction. Okay? There's a medicine called mepolizumab, which is now being researched. However, the results are not very convincing. But in 2007, which I had seen published in Lancet, were not very convincing, or also published in AGRCCM, were not very convincing. But recently, in 2009, the one published in NEGM has shown perhaps it is very important in controlling asthmas, which may not respond very well to your steroids. So the function is to create an anti-IL-5 antibody. So this thing, there's an antibody created, so this thing doesn't function. So there is no eosinophil. So basically, with an idea that eosinophil is so important cell in asthma, this type of medicine was discovered. However, let us not talk about things which will come after 5 years. This effect is effectively abolished by steroids, as I mentioned. So steroids all 3 times. So what is the treatment of choice for allergic diseases? Steroids. Yes, inhale steroids because it doesn't have side effects, very less side effects. Then we had IgG antibodies, which primarily functioned by sitting on receptors called FCE epsilon R1 high affinity receptors. And once they sit on it, an allergen acts, it degranulates the cells, particularly the mast cells, and that's how everything gets secreted. Now there is a medicine called omlizumab, which primary function is to sit on that point where it fits into the receptor, so this IgE doesn't sit on the receptors. Okay? So what does it mean? Omlizumab. Yes, sir? Okay. It's a very interesting question and a very common mistake performed by the physicians. What happens is DAC is an anti-inflammatory, right? It destroys and what has been observed? The patient's anti-helminthic infection. Pardon? See, the diethyl, I forget that name because I never use it. It has been there used by chest physicians since probably I was born. Now the reason is it acts as an anti-inflammatory, and eosinophil cells are, as I told you, is a second line defense to destroy even the worms. So what they found, actually, if you relate any clinical improvement, it could be because of the worm infection, which we do not know, but it definitely has no role in management of asthma or allergic diseases. Probably a patient has shown an improvement in DSC and the doctor is happy about it. It would be worm infestation which has caused increase in eosinophil, and that increase in eosinophil is causing the symptom. But frankly telling you, that is a very rare case. You don't give your asthmatic, they will not get treated by DSC. You get that asthmatic or allergic rhinitis. Okay? So DSC has no role in management of allergic diseases. Okay? So immune therapy, this is an old age mechanism. I did not know this is so old. Yesterday when I was talking to Dr. Mahesh, I realized this is probably as old as 1935, that immune therapy causes the increase of hemoglobin G. So now B cells which were triggered to produce IgE now start producing IgG. You get that? So when they start producing IgG, there is no IgE, and then your allergic response reduces. So this is a mechanism which has been considered for long for how immune therapy works. Okay? Now, do all allergens need IgE to manifest? Please tell me that. Can anybody answer that? Do all allergens? See, if you tell me, there is a medicine in the market, only Zumab. This is an expensive treatment. It can be very effective. It can replace steroids, right? Because it finally stops IgE. But do allergens need IgE to manifest? Okay. Most non-occupational allergens